Hello, my name is Dr. Larry Filak. I'm an optometrist and the practice owner of Premier Eye Center in Shrewsbury, Pennsylvania. And I would like to speak to you about dry eye. Well, what is dry eye? Dry eye can be very confusing because it is more than simply dryness of the eyes. We typically don't get a dryness of the eye until a much later state of the disease process. In the early stages, you can have eye strain or fatigue, a tired, heavy feeling of the eyelids, fluctuating vision throughout the day, burning, stinging, and believe it or not, tearing or watering of the eyes, which makes the term dry eye very confusing. The tear film is made of 3 layers: an outer oil layer, a middle water layer, and an inner mucus layer. The 2 most common types of dry eye we deal with are either an oil producing problem, which is a lipid deficiency, or a water producing problem, which is an aqueous deficiency. As we blink throughout the day, there is a constant fresh exchange of oil and water to help coat the outer surface of the eye called the cornea to protect it, as well as to help us maintain clear vision. Contributing factors for dry eye can be aging, diet, or medications, a hormonal imbalance, and environmental factors. And in particular, in today's digital world, it is the digital devices that are contributing to dry eye disease, especially in our youth, since they have been introduced to digital devices at such an early age. As we stare at these digital devices, we are not blinking properly. Our eyelids are not touching to activate the tear glands, or we're just not blinking enough throughout the time that we're staring at these digital devices. So we're finding that 80% of our dry eye problems are actually an oil producing problem, where the meibomian gland is either not functioning properly, getting clogged, or literally dying. So we use an instrument called a meibographer, and that allows us to screen patients of any age to determine the health of these meibomian glands inside the upper and lower eyelids. Then we can determine a management plan to save these glands to produce, or rather prevent or slow the progression of any further damage. Our ultimate goal is to get these glands to function properly in order to save our vision and protect the health of the outer portion of the eye called the cornea. Proud to say that I'm the first optometrist in South Central York County to have this technology and provide it to all patients of any age when they present for their yearly comprehensive eye examination. There is no cure for dry eye disease. However, if we can start at an earlier point in the process, then we can come up with a management plan to prevent further loss of these glands and get them to function at their best. My staff and I look forward to helping you with your dry eye needs. And if you have any further questions or concerns, please feel free to call our office at any time to schedule a consultation for a tear film analysis. Thank you.